Thanks for being here, Dr. Bissell. I'm Jen Harris of Montgomery County, and of course, joining us is Dr. Bissell. And we're going to do things a little bit differently for those of you who have been participating with us over the last, I don't know, over a year now. We've been doing these weekly calls, and we have a statement prepared for you that Dr. Bissell usually reads to give you a quick update, and then we'll take your questions. Well, this time, we're going to start out the gate with questions. And Dr. Bissell, just so you know, we already have two waiting in the queue for you. So I'll hand this over to you and let you take over.
That's great, Jen. Thank you so much. And thank you all for joining us. Yeah, I don't have a prepared statement. I think we all know we're in our Omicron surge right now. We do have epi curves, which will be posted today on our NRV Road to Wellness website. The state overall is seeing a significant increase in cases. I think most of you probably saw the news that Governor Northam just today, just about an hour ago, announced a 30-day state of emergency, not unlike what happened up in Maryland with Governor Hogan. And that gives our hospitals the capacity to increase their beds so that they can take care of patients. And remember, it's not just COVID patients, but certainly because Omicron is so much more transmissible, even though it does very much appear that it is less severe disease, decreased length of stay overall, there are more people who are presenting. So the hospitals are busy and remain busy. So hoping to get through this surge, but I'll go ahead and just take questions from folks. Messaging is definitely the same. We have a very safe and effective vaccine. Our cases are definitely increasing. But those who end up in the hospital still are overwhelmingly unvaccinated, and certainly those who end up needing the most critical care and those dying are overwhelmingly unvaccinated. And even those who are vaccinated that end up in those categories tend to have other comorbid conditions, putting them at higher risk. So,
okay. So the first question, and just so you, I see a few folks who haven't joined us in a while, and I even see a couple of new names. If you have any questions, please ask them in the chat or the Q&A. And the first question's coming in: how massive was the recent spike in cases over the past few days? What caused it? Is there a certain age group or location that's affected?
Are there certain age groups or locations? These things do tend to come a little bit in waves, although I will say Omicron has definitely hit us much more at the same time than the previous waves had. Pretty much the entire country right now is seeing surges. Here in Virginia, definitely the northern Virginia area started seeing their surge a little bit before we did. Some of our Southwest folks also started to see it a little bit earlier than we have, but pretty much across the state right now, we're a couple of weeks in, 2 to 3 weeks in. We do expect to peak in the next week or two. Here in the New River Valley, we might have a little bit of a difference because of the return of our college students, but we do expect, based on data from South Africa, from the United Kingdom, from places in Europe, that the cases do increase exponentially over about 4 weeks, and then they drop off pretty precipitously as well. So we expect that we will be hitting that peak in the next week or two, and then we'll see a sharp decline in cases. As far as age groups, I think it's those who are out and about more. So it's our adolescents, our young adults, our family folks who did a lot of traveling, people who
Flurona is. Has it been around since 2020, or is it new? And what are the symptoms? How do you treat it? Give us some information about that, please.
So Flurona is somebody who has both COVID and the flu. We didn't see a lot of flu in 2020. We'll have to kind of look back through data. We didn't do a lot of flu testing, I think, because we were so focused on flu, and we had numbers from our southern hemisphere, which obviously has flu season before we do, that their numbers were way down as well. We also had a lot of people who were staying home more and not doing as much socializing and traveling, which obviously decreases the transmission of flu, like it was decreasing the transmission of COVID. So it's not surprising. The Southern Hemisphere definitely saw more flu cases, so we were expecting more flu cases, and we have definitely seen more. People can get sick with multiple things at once, and so if you have both flu and COVID, similar symptoms. And the only way to know for sure if it's one, the other, or both is testing, which I know for some, the rapid testing for COVID can be challenging now, but presenting very similar. You can have fevers, you can have chills, body aches, headaches, fatigue, just not feeling well overall. Sometimes people have upset stomach and those kinds of things, but mainly the upper respiratory, cough, congestion, those kinds of things. And really, we do have antivirals for flu that we try to treat within the first day or two of symptom onset. And the flu often presents like you feel like you've been hit by a truck. I mean, it's a very sudden onset. COVID, especially Omicron, which is looking a little bit milder, may just come on and people may question whether it's just a common cold, may question whether it's allergies. So there's a little bit of a difference there. Certainly, those who have COVID and are higher risk of progression of disease, we do have therapeutics for that as well, the monoclonal antibodies and the new pills. Although we have to say that those are still in short supply. The entire state only gets a certain allocation. So I think the antivirals to treat flu, Tamiflu, I think a lot of people have probably heard of those. Those are a little bit more available, that you can get those by prescription at your pharmacies. The antivirals, the monoclonal antibodies for COVID, again, your healthcare provider should reach out about trying to get those, but those are a little bit less available at this point.
Okay, we've got quite a few questions coming in, so thank you all for these great questions. Jenny's asking, has it become common for people to experience guilt or shame when they are diagnosed with COVID, especially when they've been very cautious? What is your advice for anybody who may be feeling this way?
COVID is everywhere. This is our transition to endemic. I think Omicron is really speeding that up because it is so highly transmissible. So, my advice is to not feel guilty, and we shouldn't shame anybody into feeling guilty that they've gotten COVID. I think it's likely that we're all going to be exposed, and a lot of us, if not most of us, will develop COVID at some point. And eliminating COVID very early on, it was obvious that was not going to happen, that it was just not going to be the end game. So, we've got the vaccine that was approved in a record time, so showing very good safety and efficacy profiles. And the vaccines are doing what they're meant to do, meaning that they're keeping people from getting super sick, from ending up in the hospital, and from dying from COVID. So, that's helping us. That's the flu vaccine as well. I mean, every year when we give flu vaccine, we tell people, look, it may not prevent you from getting flu, but it's a public health success if it keeps you from ending up in the hospital or dying from flu or its complications. And these vaccines are holding up well and doing that with COVID. So everyone has to do their risk assessment to inform their behavior now. I understand everyone's tired. We are at 2 years coming up here in February. We really are at 2 years of this, and people have had enough. They want to get back to doing things. And it really is a matter of doing those risk assessments. People who are younger, healthier, vaccinated, at lower risk, their behavior might be a little bit different than somebody who is at higher risk with multiple comorbidities or older or immunocompromised. And then we also have to do those assessments about who else, we will come in contact with. Do we have that older relative, or do we have that young child who can't be vaccinated, or that older relative who's higher risk? And those are the things we should be doing with any of these communicable diseases. The same thing with flu. We don't want to give flu to those folks who are at higher risk from it as well. So I would say no more shaming. We have a great option. We have great options as far as vaccinations go. They're doing what they're meant to do. COVID is around. It's here. It's not going away. We do our risk assessments to go ahead and inform our behaviors.
Thank you for that. Okay, our next question is about positivity rates coming in from Eric. So, is positivity rate still a reliable metric given the scarcity of tests and the fact that people probably aren't reporting the results from any at-home tests they may be able to take? So, if the
No, I
current
agree.
rate, yeah, if the current rate is 35%, is that accurate? And if not, what do you think? What's your thought on that?
So, I don't think positivity rate is very reliable, and I don't think case counts are very reliable right now for those exact reasons as well. You know, people, they're not reporting home tests if they can get access to home tests. We aren't getting a lot of people who are self-reporting those, even though we do try to encourage them. And we want people to report both positives and negatives because we are trying to get a good denominator here, but especially those positives. And we want people who test positive to know about the isolation guidance. And they can certainly always call the health department. But you're absolutely right. Test availability, especially the rapid tests. People who have symptoms choose not to get tested if they're mild. They know so many people who have it, they just assume they have it. Those are all issues that affect, the number of tests, the number of tests we do, and the positivity rate. So, we're seeing in the numbers of tests that we're doing that we're in that surge. And we fully expect that for every case we're documenting right now, we have at least 3 to 4 others and possibly even more. So I think we have to accept that it is extremely transmissible, that it is spreading rapidly, and we're seeing all the results of that.
Okay, up next we have Ashley. With VT students returning to campus next week, or even, what's going to happen, and we probably already have some here now, what do you think Blacksburg is going to look like in the coming days and weeks?
So, I think the students are coming in this week, and our Radford students are coming into Radford as well. They start classes, I believe, on Tuesday. So we do expect that they may add to our cases. We are not expecting any significant surge from them like we had in the fall of 2020 when they came back. Remember, they all had a vaccine mandate. Both schools, along with the public universities in the state, have implemented booster mandates as well. And a lot of our students are coming from other areas of the state that really started their Omicron surge even before we did, and may have already been exposed or been infected with Omicron. So we do expect that it may increase our cases some. We aren't expecting that it's going to be a significant change, especially given the number of students. I mean, between our 2 universities, that increases the New River Valley population by about 40,000 people. But given those other factors, that they're vaccinated, they're boosted, they're coming from areas they may have already been exposed, many of them have already had COVID, we certainly do not expect the surges in case numbers like we had when everyone was naive. We didn't have the vaccine, and we did see case numbers really increase on our college campuses. The other thing I'll say is that, our college students in general, they really did not spill over tremendously into our community. They really did, when we saw those surges in cases, our community cases and our younger kid cases really did not go up significantly. Right now, our community cases are surging. So like I said, it's everywhere. And we just really don't expect that there's going to be that significant contribution. Our college students are unlikely to be a significant stress on our healthcare systems, our medical systems, which is another good thing as well.
Okay, Jean is asking about the flu Rona. Is that in our region? Are you able to speak to that, whether or not there are any cases?
We definitely have had some cases of both COVID and flu, yes. Okay. And again, obviously those people might feel sicker because it's like a double whammy. I honestly don't know about hospitalizations with COVID and flu, but both of them can lead to hospitalization, separately. So together they could certainly lead to hospitalization. But I do know that we've had cases of both COVID and flu. Now, remember, flu is not a reportable disease anymore. We just do surveillance. We still do have a lot of providers who send us flu reporting, but we don't get the reports like we do the COVID. But our case investigators, our nursing staff, our folks will talk to people who said, yeah, I tested positive for both. So it's definitely here. It's everywhere. The flu strain that has been going around, the H3N2, is a flu A, which tends to cause more symptoms. And remember, we had pretty significant jump in our flu cases in our college students before the Thanksgiving break. And most of them who had COVID before said that the flu made them sicker than COVID ever did. We didn't see a huge jump in our flu cases when they came back from Thanksgiving case, but flu is still out there and circulating. And COVID is out there and circulating. So people are at risk for both. And it's not too late to get vaccinated for either, because any vaccine, even though we talk about 2 weeks, to get that full protection, any vaccine starts working pretty well, pretty quickly. So any protection you can get is worth it.
Okay, Jean also asked, we've talked about, or you've shared lots of times about how the Omicron is something that, might not be as severe and it's highly contagious. And so what do you say to someone who just typically, they're not sure if it's a common cold, or maybe it is a flu, or it is allergies? What should they do in terms of getting tested?
So, obviously, to know for sure what it is, we recommend testing. The New River Health District, we are able to meet our testing demand right now. We have definitely seen an increase in the demand for our testing, but we are able to do our PCR tests and get the results back by the next afternoon. And that definitely helps. The biggest thing is for people, especially who decide they don't want to get tested, and this is an infection prevention thing that we hope outlives the COVID surges, is that when people are feeling sick, to please stay home and to not be out and about and spreading disease. So, if you're having symptoms, and especially, those going into schools, those going into the workplace, we definitely want you to stay home if you're sick. And if you get tested and you find out that it is COVID, that it's flu, that it's both, our guidance for flu is really that you can return when you're feeling better and you've been fever-free for 24 hours without fever-reducing medication. Obviously, with COVID, the new guidelines are 5 days, and symptoms are either asymptomatic or symptoms are improved, and feeling no fever for 24 hours without the use of fever-reducing medications as well. So, I think that's the biggest thing, is to make sure that people who are sick stay home and stay out of circulation, so they're less likely to transmit disease.
It appears that we have about 6 more questions in the queue. So again, if you have questions, feel free to ask them in the chat or the Q&A, and we're answering those in the order in which we receive them. So Ashley's asking, the CDC recently updated guidance for healthcare workers that they can come back to work COVID positive as long as they're asymptomatic. What are your thoughts on that? Is that a good choice?
So they make that very clear that, that's kind of a resort if you have to, from a critical staffing issue. I will say those who remain asymptomatic, are unlikely to spread the disease. It's the folks who are symptomatic. We know that the greatest period of infectivity is about a half a day before symptoms start, and for the first couple of days of those symptoms. So again, talking about the difference between pre-symptomatic and asymptomatic, but we know people who remain asymptomatic are unlikely to spread the disease as much. And again, healthcare workers are going to be doing universal masking when taking care of patients. And I do know that they also, a lot of places that have resorted to doing that are trying to cohort such that COVID positive employees are taking care of COVID positive patients. So it's one of those things where there are definitely trade-offs, but certainly someone who's asymptomatic is unlikely to cause significant spread. And our hospitals right now, are feeling the pressure, and it's not just the physical beds, but it's also the staff to take care of people in those beds. So we have to do what we can to protect our healthcare system, to keep our healthcare system functioning, because remember, people are getting sick with everything else, other urgencies and emergencies. in addition to COVID. So we have to do what we need to do. And certainly I think that is a reasonable thing, especially in workers who may have had COVID before, workers who have been vaccinated, who've been boosted. We are finding that they have very mild symptoms to no symptoms at all and can function perfectly fine.
Okay, Nick is asking a question about vaccine and asking you to talk a little bit about maybe the uptake in the vaccine. And have there been any significant increases in first doses and or boosters that you have seen recently?
I wouldn't say significant. You know, I think with the talk of Omicron, we did see an uptick in people getting vaccinated, both primarily and with the boosters. I think it's kind of leveled off, and you know, we're trying to do the best we can to make it as accessible and available. We continue to distribute vaccine to a lot of our pharmacy partners who are giving it. We continue to give it in the health department. You know, boosters are now authorized for 12 and up for the Pfizer boosters, 18 and up for all 3 vaccines. People can, you know, essentially mix and match. And again, that's part of that risk assessment. And I think that the people who wanted them have definitely gotten them. The people who the Omicron surge kind of it nudged them along, that they are the ones who are getting it now. And then we do have some folks who are not choosing to get them, and are probably not going to get them. Although I will say, I do think that we'll probably end up with an annual flu kind of COVID booster. So this fall, we may be talking about doing boosters again. I know there are some combined flu COVID shots in clinical trials right now.
All right, Alexis has a few questions here. First, are you worried that people might start hoarding tests because of lack of accessibility?
Yes, and you know, I mean, we've definitely already seen that where our stores, as soon as they get them in, they're off the shelves, and they've limited the numbers that people can buy. You know, people who really are creative, I'm sure will find ways around that. And it's challenging, remember, because we did put it out there that the safest thing to do is test even a couple of times a week. And it's really hard to do that. That was meant to be with an antigen test at home. It's really hard to do that with testing availability being very limited right now. So, you know, given where we are right now, as I said, the health department testing availability is really good for the PCR testing. You know, given where we are, I would encourage people to really, you know, use the testing wisely and to please not hoard. You know, we can test with symptoms, we can test with high risk exposures. You know, we want to have that testing availability for the people who do need it most, and especially those who are vaccinated, those who are boosted. You know, their likelihood of getting a severe case of COVID is pretty small, so they can follow the current guidance based on symptoms. And if they have symptoms developing consistent with COVID, you know, going ahead, and certainly with a known exposure, which is pretty much anything nowadays because the disease is everywhere, you know, go ahead and isolating for those 5 days. If your symptoms are improving and no fever for the 24 hours, then you don't even need a test to come out of isolation. If your symptoms aren't improving now, then, you know, definitely stay home until those symptoms are better. So I do think that we can kind of weather it if people choose to do it that way. But I'm sure there are people who are hoarding tests, which makes it challenging for those who need them.
And so to follow up on that, are you concerned about people having to travel to other districts to obtain a test?
You know, I mean, just like when the vaccines first came out, people are going wherever they can find them. So I'm sure there is some of that as well. I'm sure people are shopping online and getting them shipped. You know, again, I think there's a smart way to do it. And I think, you know, we can be mindful of it. I know the federal government says they're going to start shipping tests out. So a lot of the companies have really increased their production to start getting them off the line. So hopefully we'll see increasing availability. And again, I know that's the rapid test. People want that 15-minute or 30-minute, answer. But we do have the PCR test, which is a reliable test. And we can test and have those results back the next day here in our health district with our partnership with Fralin Lab. So we do have access to testing. It's not always exactly what people want, but we do have access to testing. We are testing every day in the district. We're testing Mondays and Thursdays at our Montgomery Health Department. Tuesdays we're at Floyd. Wednesdays we're in Pulaski, Friday mornings we're in Radford, and then Giles is working through their administration and they're testing on a regular basis as well. Our testing over the summer, we never stopped testing. Our testing over the summer went down to just a handful, and a lot of it was travel related. Then our testing picked up with the Delta surge, dropped off, and now obviously our testing is picking up significantly. I think today we did over 100 tests here at Montgomery. So it still is an option to get tested for COVID. We do not do flu testing at the health department. So those would have to go through your urgent cares or your primary cares. Again, given that our hospitals are so busy, I would ask people not to go to the hospital for those kinds of tests if you're not feeling super ill, because our hospitals really are busy and they don't need folks showing up who don't need to be there.
Okay, we've got 2 more questions here in the queue. Again, if you have any questions, you can ask them in the chat or the Q&A. Eric is asking, are you still seeing the Delta variant in Virginia? And if so, would that change the trajectory of the curve of cases?
Yeah, so we are definitely still seeing Delta. I think the latest CDC estimates for nationwide are about 95% Omicron. As of last week in the New River Health District, we were over 65% Omicron. Given how quickly Omicron is doubling every couple of days, and it is definitely more transmissible than Delta, we do expect that it's going to kind of push Delta out. I don't have this week numbers about what the percentage is, but we do expect that Omicron is going to take over and just overwhelmingly be the majority of cases like Delta did earlier in the fall. But yes, we are definitely seeing Delta still. Again, when we're looking at severity of disease, Delta was more in line with the B117 and the original variant in that you can get the pneumonia and, severity of disease. Omicron tends to not be as severe. The length of illness, the length of hospitalizations tend to be lower. And it appears to cause more of those upper respiratory symptoms, not so much the lung symptoms and that shortness of breath. So we are still seeing people who are getting sick, and those folks could very well have Delta still circulating. But we do expect Omicron is going to push it out.
Okay, we have jump over to a vaccine question. What would you say to people who are concerned about getting too many vaccines as new variants arise?
So again, this is where I think people need to do a risk assessment. This was a novel virus. Nobody's immune system had seen it before. So people got infected, people got vaccinated. As it's going to do what viruses do, and it is going to mutate, it's going to change, it's going to become more transmissible. Usually, I can't say it 100%, but usually when this happens, they do become less deadly because they don't want to kill off the host. It's that evolution. As more and more people get vaccinated, as more and more people get infected, there is a level there that the disease burden, the cases become less severe. The vaccine is very safe and effective. Obviously, it's a new vaccine. We've had it for just about a year. I will say it is immunogenic. It does create a very robust immune response. And we don't have a good idea about what the ideal number of shots is. We do know that people who've been vaccinated, and the Virginia data really doesn't doesn't separate it right now as those who are boosted versus those who just had the initial primary vaccination series. We do know that those folks are still very well protected against severe disease, hospitalizations, and deaths. The vaccine, though, it is very safe. It is low risk. It is not no risk. So, for instance, people who are older, people who are immunocompromised, people who have comorbidities, definitely, getting that booster is really important right now. People who are younger, who have very robust immune systems, no comorbidities, who may have had COVID before, getting additional shots is probably not as necessary. And that's where people have to do their own individual risk assessments. As far as where we're going in the future, as I said, I know they're already doing clinical trials on combined flu and COVID boosters, and I would expect that this coming fall, when we're doing our flu campaign, that we will be offering flu COVID boosters, either combined shot or separately. COVID has shown that, like these respiratory illnesses like the flu, it's seasonal, so it spreads regionally. Here in the New River Health District, we don't normally start the flu season. Flu season starts in our more urban, highly populated, population dense areas, and then it kind of travels down the 81 corridor or up to 77 corridor. COVID did the same thing. Over the summer, we were very fortunate. People were outside more. Our cases went down significantly, but that's when our neighbors to the south, because of the heat and humidity, and people were driven indoors for the air conditioning, their cases surged. And then we started to surge once people started spending more time indoors. And of course that, also kind of came along right with our holiday gathering season. And then of course, Omicron. So, kind of a triple whammy there. But I do think, we have to expect that we will be doing booster shots, just like we do the flu shots as well.
Okay, Alexis is asking, going back over to appointments, some people are struggling to get appointments for COVID testing on the day, on a specific day, and they have to wait a few days in order to get the next available time. So is that becoming an issue, or does that worry you at all?
So, yeah, I understand that, our urgent cares run out quickly and appointments go quickly. I understand that, our pharmacies and some of the minute clinics and those things. I will say at the New River Health District, at our testing, there's no appointment necessary. It is walk up. So again, on Mondays and Thursday mornings, and this information is on the NRV Road to Wellness website. On Mondays and Thursday mornings, we're at Montgomery Health Department in Christiansburg. On Tuesdays, we're at Floyd Health Department, which is just out Route 8. On Wednesdays, we're at Pulaski, which is in downtown Pulaski on 4th Street. On Fridays, we're at the Radford Health Department, which is on Main Street in Radford, across from the Radford recreational fields, and that is walk up, no appointment. And again, Monday to Thursday, you get that result back the next afternoon. Friday, you usually get the result back later that evening or Saturday morning. Giles, again, that's run through Giles County Admin, and they do testing fairly frequently as well. So testing is available. It's not always exactly what people want when they want it, and it's definitely not the rapid testing. We had some rapid tests that we were using. We worked with our community partners, with our jails, with some of our congregate settings, our residential living facilities, to make sure that they have rapid testing, which is really important. But those supplies have gotten, critically low right now. So there is testing available, but it's not always what people want. People want that immediate result of the rapid test, and those are definitely tight right now.
Okay, so you mentioned Omicron is less severe. So as follow-up to that is from Ashley. Do you think we'll see another variant soon? Or is it early? Is it too early to say if we do see another variant, what it would do?
Well, I think, yes, there will be other variants. There already are other variants. The World Health Organization, the CDC, VVH, they list variants of interest, variants of concern. There are lots of other variants, but a lot of them really don't take off per se. you know, they have to have a certain degree of transmissibility where they kind of knock the other ones out of the picture and they become those predominant variants. And that's, you know, we talk about COVID not going away. And this is what viruses do. They mutate, and that's what causes these other variants. You know, they mutate to try and be more transmissible and to try and kind of propagate, right? So there will be other variants, and that's when we talk about we have to make that transition from, you know, the pandemic to endemic, that COVID's not going away. It will be around in one form or another. There will be different forms, there will be different variants. You know, so far the vaccines are protecting, and again, just like the flu, because we have so many different strains of flu, you know, our flu vaccines in any given year, when you talk about actually preventing infection, they may be 40% or 50% effective. You know, that's better than 0%. And again, if they prevent those severe complications. So we need to transition to that thinking that it's going to be around. I need to learn to live with it. There are going to be other variants. It's not going away. You know, I very well may get it. You know, I very well may be likely to get it. But if I'm protected in other ways, having had it before, having been vaccinated, you know, the likelihood that I'll have a severe case is much, much reduced. And so we can live our lives. And that's that transition. You know, interestingly, we look at flu. As I said, we really just do flu surveillance right now. Flu is not a reportable disease, but we do surveillance to see what's out there, to see what is spreading, and we monitor. It's an endemic infection. We monitor it through surveillance, looking for anything that could become a pandemic, such as the H1N1. And then we monitor the severe outcomes. You know, we monitor those hospitalizations and those deaths. We monitor the deaths in children. So flu, we do surveillance to monitor, you know, to try and be prepared in case it's going to transition from endemic to pandemic. COVID right now, we're trying to make that transition from pandemic to endemic. And how do we learn to live with it? Because it's not going away.
Thank you very much for your time today. That appears to be all the questions we have. We look forward to next week.
Jen, thank you so much. Thank you all for joining us. Yeah, so we'll see what our numbers are doing next week, the next couple of weeks. I think it'll be interesting.
Take care. Thanks. Bye-bye.
Okay, bye-bye.